We are delighted to welcome Congresswoman Renee Ellmers to our Conservative Women's Network today.
Thank you so much. It is absolutely wonderful to be here. The Heritage Foundation does so much good work, and I will say that when I first started speaking out against Obamacare, well before I had considered running for office, the Heritage Foundation, the information that the Heritage Foundation provided that we could use as we were speaking was vital to our cause as we would go out to groups basically in North Carolina and speak and explain to people why it was so important and how it was so detrimental to health care. So I do appreciate that. And to the Clare, Boothe, Luce Association, just wonderful work. And thank you so much. I'm honored to be here. And thank you for having me. I appreciate all the work that the conservative cause for women. We have got to, as women, work together. It is wonderful to look out into this audience and see women of all ages, especially young women. It is so important that we continue to put forward a message so that our young women can come into our group and appeal to them. As Margaret Thatcher once said, being powerful is like being a lady. If you have to tell people you are, you aren't. When I ran for Congress, I vowed to repeal Obamacare, and with one of my very first votes in the 112th Congress, I voted to repeal it. I'm proud of that decision because I know firsthand the damages that it will do to both health care and our economy. As a nurse for 20 years, actually over 20 years now, and owner of a wound care clinic. My husband is a general surgeon. We turned part of our practice into wound care because, you know, we were starting to see the effects of the economy in medicine on our practice, so we wanted to expand. And that was one of the decisions that we came up with, was to try to increase our volume. And that's what we do as business owners. You know, we do what we have to do to make those choices so that we can improve the health care and ourselves. You know, we need to make money to keep running that business and pay our employees. In the face of rising unemployment, unsustainable federal debts, and overwhelming public opposition, Democrats decided to make an unpopular government takeover of health care their priority. It took them more than a year to cobble together an unpopular government takeover of health care, so riddled with provisions that violate right-to-life principles and support government rationing of care that patching it is not an option. Those trying to sell the bill to the American public claim it will reduce the deficit, but we now know the opposite is true, as countless hidden costs have come to light. Even worse, there are more than $500 billion in tax increases, burdensome IRS 1099 reporting requirements, and countless employer mandates associated with the bill threaten the further cripple an already struggling economy. Rather than protect and strengthen the Medicare program, this law takes more than $500 billion from Medicare and uses the funds to create a new entitlement program that our country cannot afford. President Obama's own actuaries at the Centers for Medicare and Medicaid Services warn that the Medicare cuts contained in the law are so drastic that, and I quote, providers might end their participation in the program. We are already seeing this. We are already seeing providers cutting back on Medicare patients and Medicaid patients. Many of us in the healthcare field have already seen evidence, and we're dealing with it every day. Especially in the rural communities, this is very significant. Obamacare is bad for workers, it's bad for employers, and it's bad for America. Repealing it allows us to start with a clean slate. We must work towards market-based reforms that will actually lower health care costs, increase accessibility, Let Americans keep the plans they have and forestall drastic changes that are creating uncertainty in the lives of individual Americans and businesses. This Congress, I am committed to working with my colleagues on both sides of the aisle to repeal and replace the law's job-killing regulations and state bankrupting mandates because it's the right thing to do. I know I came here to speak to you today about health care issues, and obviously those are pivotal and the mess we are in currently. But something I cannot and will not ignore is the economic crisis we are wrangling with today. It is truly a crisis. Yesterday evening, I went to the floor of the House to remind my colleagues on the other side of the aisle that we are debating amendments on a continuing resolution not because we want to, but because the leadership of the 111th Congress failed to do one of their most basic jobs, pass a budget to fund the federal government. Left without a budget to work with, our financial house is in shambles. It's clear that we are in a state of financial crisis. Our debt requires immediate action, and this continuing resolution is just the beginning. I came to Congress because, like many others in my Republican class, my freshman class, there are a number of us who are small business owners. Sticking to my budget, trying to make plans for the future, all of these, while we were watching Washington politicians drive the country's economy into a ditch. I knew that something had to change. My colleagues on the other side of the aisle are trying all of the same work and all the tricks, but you must know that this is not about tricks in politics. This is about preserving the greatness of America. No one in Congress finds the joy in the tough decisions we are making right now, but we can no longer ignore them. The American people have elected this Congress to be good stewards of their money. I told them that today is not a happy day and that this is not a happy speech. Government spending and burdensome regulations have driven the American people to anger, frustration, and with good reason. Sadly, our nation stands on the edge of bankruptcy. Our love for future generations of Americans requires that we not ignore today's problems, only to find them years from now in irreparable financial ruin. Regardless of the program, today's deficit spending is tomorrow's tax increase. In my neighborhood that I live in North Carolina, there have been 3 babies born recently to some of my friends. Each of these babies now owe over $45,000 in federal debt. We are fighting for our very survival. At risk are the freedoms representative of a free market economy and free society, the freedom to choose, freedom of private industry to compete, freedom from burdensome taxation, and freedom from mandated government programs. Washington today is slowly smothering the personal liberty Americans so greatly esteem. As the 112th Congress struggles to pass legislation that meets our nation's current challenges, fundamental disagreements still remain. Unfortunately for the American people, the debate is being framed by my colleagues on the other side as vicious cuts to vital programs by Republicans who simply don't care. Hear me now when I say to you, this has never been farther from the truth. Today we must come to terms with the fact that we cannot spend money for everything we want, regardless of the good intentions involved. For years, politicians have ignored these problems. Not this Congress, not this Congresswoman. The people elected us to end the talk and take swift action, and we must. As a small business owner, when finances get tight, we cut where necessary. Raising prices isn't always an option. As painful as it may be, you make tough decisions to cut waste, operations, production costs, and eventually jobs as a last resort. All of these decisions are tough, but survival demands it. Why should the federal government be any different? Today's debt crisis is a very real threat to our liberty. Liberty allows people to work hard and achieve what they want, be responsible for their own actions, and be free. No one shackled by debt is free. The other side wants us to redistribute the nation's accomplishments. When a government takes from its people, it eliminates the incentive for individuals to succeed through their own hard work. Today's budget crisis is dangerous and threatens our basic freedoms. Free societies value every citizen equally, placing no preference one over another. I believe that no one should be entitled to another's hard-earned provisions, and that government should support its citizens, not burden them with cumbersome debt and obligations they cannot fulfill. Government spending is not the answer to the looming problems. While every American has a right to pursue happiness, none has the right to do so on the back of his neighbor. Deficit spending does just that. I know there will be those who argue that my rhetoric is too harsh and that the financial crisis is not as bad as it seems. However, the crisis is real, and without immediate change, America will continue spiraling towards a financial disaster. I challenge my colleagues to let real leadership begin, and I know you expect the same. No longer should we turn to China to finance that which we cannot afford. It's time we live within our means and stop wasting the hard-earned wages of the American taxpayers. I believe we must have the courage to right our wrongs, the strength to see it through, and the vision to lead with the powers entrusted to us from the consent of the governed, rather than selfish ambition. The future of America depends on how we handle these challenges. Toward the end of his life, and with his typical humility, Ronald Reagan said, "You know, I wasn't a great communicator, but I communicated great things. And they didn't spring full blown from my brow. They came from the heart of a great nation. From our experience, our wisdom, and our belief in the principles that have guided us for 2 centuries. Ronald Reagan was a man of destiny. However, he insisted the destiny was not his own. Rather, it was the destiny of the American people. It's time we realize that destiny again." Thank you so much. It's been an honor speaking to you. Thank you. Oh, I'd be happy to, yeah, especially for you. We got some time.
Terrific. We have microphones here, and we've got time for a few questions. So, ladies, this is your chance. I see one over here already. Everybody else get revved up here now. Please introduce yourself and tell us if you're associated with an organization.
Hi, Allison Miller with Heritage.
Great.
Thank you for coming to speak to us, Congresswoman. My question is, what was one of the biggest surprises or unexpected things that came up when you were campaigning for Congress? What was your biggest shock or surprise?
Ooh, campaigning. Well, I will say, and it really wasn't a shock to me, but the true concern that I saw across my district and outside of my district in North Carolina. You know, one of the things that I think we're seeing a change in is for so long, you know, you saw the political rhetoric, the Republicans versus the Democrats or liberals versus conservatives. But there was a kind of a resting on our laurels kind of mentality, I think, where people maybe didn't realize how bad things were from an economic standpoint and from a national security standpoint. I think those are things that the American people, and especially those in North Carolina, have really seen a change in. And as difficult, again, as some of these decisions are that we're making right now, I think the American people are finally open to that. And that was, I don't know if surprising is really the word, as it was welcoming, because I knew that people understood how serious the issues are that we're facing today. Thank you. That's a good question.
Okay, right here in the middle.
Hello, my name is Calandra with Heritage. What would you say has been your main focus point when debating with liberals about alternative reform measures, especially market-based reforms?
Well, there again, the health care issue is a perfect example of that. You know, we really want the same things. We all, you know, those who are in Congress, whether they're on the left or the right, we all want what's best for America. It's just how we go about doing it. They seem to think that government running us, they underestimate the strength, the will, and the intelligence of the American people. I see it every day when we're doing our committee hearings and things, where there seems to be this overwhelming fundamental mentality on the left that the American people cannot take care of themselves. And it is the government's job to make sure that all the needs and wants of Americans are taken care of. And that's, I think, how we've gotten so out of control. Their intentions are wonderful, and I understand them. I have them myself. I just believe that the American people are the ones who should be making those decisions and taking the charge and leading their own lives and making decisions for their families. You know, whether we're talking about education, when we're talking about health care, who better to provide that to your children than you? Who better, what a better education for our children than to say to them today, this is how we're supposed to be running a budget. You cannot spend money you do not have. You can't just use a credit card. You know, there's a great credit card, and I'm nothing against credit card companies, but there's a credit card company out there that runs ads where the gentleman walks up and swipes his card through the machine when he's buying something, and someone walks up and hands him a dollar bill. That is not the way it works. Running ourselves into debt does not gain you money back. Increasing spending and stimulus packages do not create jobs. They just create more debt that we'll have to deal with eventually, and we're having to deal with today, and it's really the reason we've gotten into this situation. So we all want the same things. I have faith in the American people, and I want to give that power back to the American people, decrease the amount of taxation, regulation. Regulation is killing our businesses. When the cost of doing business becomes so expensive that you can't hire an employee because you're dealing with those extra costs, that's where the job issue is. We can create jobs in this country, but we've got to do it by giving power back to the private sector. So.
Okay, right here.
Denise Fahmy from the Arlington Republican Women's Club. I do believe Obamacare will be found illegal, unconstitutional, and I do believe there are reforms that we can enact.
Yes.
But meanwhile, being from Virginia, I understand that we're having to spend money to prepare for it, even though this may eventually just be wiped out.
Right, and
that's
part of the problem. That's why we are working so hard in Congress right now. You know, we voted on the repeal. Of course, that's not gotten us anywhere, which we figured that would be the case. But at the same time, we're working on different pieces of legislation to reform the 1099 portion. And if you're not familiar with it, I'm not sure how many are, but basically that's mandating that businesses have to file a 1099 form for every $600 and above amount of money that they spend with, you know, buying products and whatnot for their businesses. And for some businesses, it's just an unbelievable burden. And it will, there again, contribute to that. For what? For what? So the IRS can keep track of how much your business is spending? You know, that just creates a whole extended bureaucracy in order to be able to fulfill it. So these are the issues that we're dealing with. We realize that right now as we speak, even though we feel very confident that it's going to be found unconstitutional in the courts, or that we are going to be able to strike it down with legislation, states are having to deal with it. Right now, if you have your own private individual insurance plan, you've probably seen your premiums go up significantly. And if you're an employer that is providing health care to your employees, you've probably had to make some serious changes in order to keep the costs reasonable so that you can continue to provide it. These are some of the things that we're dealing with. And what I can tell you is we are working as hard as we can to change it as quickly as we can so that we decrease that amount of time.
Right here, and then we'll go over to you, right? Very good.
Hi, Allison Howard from Concerned Women for America. Just wondering, what's the feedback that you've heard from your fellow healthcare practitioners, and I'm sure your husbands, on what the implementation of Obamacare really means for them? And do you feel like they're completely informed on the truth of the matter?
Well, what I can tell you is physician after physician that I speak to is incredibly concerned. There are many things that are happening in the healthcare field, in the healthcare industry, whether that's with, private practice, and I will say that there is a huge difference between a physician who owns and runs their own practice and one that is maybe university-based, where they're not writing the paychecks and having to meet payroll. So sometimes when you hear conflicting things out there, consider who it is that's giving you that information and what their own personal private practice or what type of practice they're in. But we are seeing this. Physicians are extremely concerned, but the unfortunate part about it is they just don't know what to do about it, and that's why are becoming more politically verbal. For most times physicians, they just don't really care about politics in the exam room. They're going to take care of their patients no matter what they're, but they are starting to speak out, and they are starting to become more verbal about these things, and they're very concerned. And unfortunately, many physicians, again, I had pointed out, are having to decrease the number of Medicare patients they're seeing, Medicaid. Some are dropping altogether. Those who are close in relation to retirement age are really retiring just to get out of the field because they just don't see a good outcome over the next couple of years. So even when we do turn this around, there's going to be a period of time of adjustment. But it is good that physicians are starting to speak out more, and they are looking at it because, as Nancy Pelosi said, we have to pass this bill so we can all know what's in it. Now that we're starting to know what's in it, people are starting to realize how devastating it is.
Okay, right over here.
My name's Kate Nixon with Heritage's Center for Health Policy Studies. My question's really very closely related to that one, but I was just wondering if you could touch on some of the effects that you and your husband are seeing personally as not only healthcare providers, but owners of a small business with your private practice.
Well, what I will say is the economy for us, when many different businesses, when you were already starting to see the effects of the downturn in the economy in many other areas, it really started to hit us a little bit later. But when it did hit, it was significant. My husband is seeing fewer patients. Now, he's a general surgeon. So whether that's because people have lost their jobs and lost their health care coverage, or whether it's just in anticipation, maybe putting things off. They might have an ache or pain that they're just not pursuing, finding out what that is, and putting it off as long as they can. So it has hurt us economically, seriously. But by the same token, in the small business community, on the Small Business Committee, we have held 2 hearings now, one last week and one this week, with excellent testimony from small business owners who have just said, it's almost, I couldn't say it any better than they were. Regulation, taxation are just killing business right now, especially small business. Small business did not get a bailout. It was only the larger companies, General Motors, GE, these larger companies now. There was no TARP for small business, for a community bank. So the cost of doing business is going up. Business owners are denying themselves a paycheck and living off of their retirement funds. This is what we're really seeing. They've laid off as many employees as they can. They fear what's going to happen. They fear the possibility of the Obama administration taking action with more and heavier regulation. And, it's all out there. So even those businesses that feel that they may have some capital right now, they're just holding on to it because of the uncertainty. So this is why we're not seeing kind of a, even though they're saying that the recession, we're coming out of it, you're not seeing it reflected in the small business community. So it has affected every sector of the economy. I don't think there are any industries except the federal government which is hiring right now.
That's right. All right, we have time for one more question from the audience, and then I get the last one. All right, right here.
Hi, I'm Brittany, and I'm with Heritage. And I was wondering, as a mother, representative now, and a small business owner, what your advice to young women who have ambitions but also really value family is.
Well, that is such a good question, because that is one of the fallacies that are out there, that if you have family values, that you value life and want to protect it, that somehow you want to be back in the kitchen, slaving over the stove with little children around your feet and barefoot. We can do it all. There are just so many, especially, with all the technology. I text my 15-year-old son all day long, in between meetings, in between house votes. I'm texting, honey, did you turn in the candy money at school? All of these things. We can do it. It's challenging. It's challenging. But these are the ones that we're fighting so hard for right now. And I am blessed. I have a wonderful family. My husband and my son are my biggest supporters. And they're always cheering me on. And now I'm starting to get all choked up. But if that's any proof that a conservative woman really does have a heart, we deal with it because we know that eventually the outcome is what we're looking for. We've got to save our country for our children, because what we're leaving them with right now is going to be devastating for them. I am saying to my son and his friends, you have a less prosperous, bright future than I had. I worked my way through college. I had to. My parents couldn't afford it. And I want my son to be responsible as well, but I would like for him to have maybe a little bit easier road than I did. But I don't know that I can give that to him right now. That's why we're fighting so hard. And it can be done. There are so many different ways we can keep in touch, again, with all the technology that's out there. And there are many, many resources available. And family, we can depend on our families and our friends. And on that note, I do want to say to my staff, Al and Josh is over there too, I have the best staff. And Al has been with me. He was my campaign manager. He believed in me when no one else was giving me a chance. They said, nurse, woman, North Carolina, 2nd District, no way can you do it. And he believed in me, and so he is my chief of staff, and Josh is part of our staff as well, and he is wonderful. So I just wanted to throw that out there.
Well, let me just ask the last question, going back to your discussion about health care. Something that is of great concern to us is that we see this tremendous leadership in the House to vote a repeal bill. That was wonderful. We don't really see that kind of enthusiasm for repeal in the Senate. It appears as though the strategy of the left is to trap you all into one omnibus bill at some point, where they say you've been voting on the continuing resolution, nothing's happened, now we have the debt ceiling vote, and now you have to pass it our way, or America will cease to exist.
Right. Well, unfortunately, that is part of what we're dealing with. Of course, we have the majority in the House, which is wonderful, and over and over and over again, many of our colleagues that have been there for a number of years will say any day in the majority is a better, no matter how bad it is a better day than the day in the minority, so even your best day. So we are working very hard, and unfortunately that is what we are dealing with. The Senate, we do not have the majority, and we realize that. And we are trying to work so that we can make things appealing to them. Now, we don't know. Then again, it gets to the President's desk, and we don't know where he will be on all of these things. He hasn't put together a budget for 2012 that anyone is very excited about. And we're, there again, it's lack of leadership that we're dealing with here. We were voted in on November 2nd because the American people are just crying for leadership from our elected officials. And it's not there. And this is why, over the next 2 years, we have got to work so hard to continue to elect good conservative candidates and to elect a conservative president who will be a leader, who will come in and take the charge on these issues that are his responsibilities. So what I can tell you is the next 2 years are going to be difficult, and we have that compromise, unfortunately, that we will have to be working with. But we are, I will tell you, this freshman class that has come in, these are just some strong-willed individuals who are not going to compromise on much. So what we can't do is hurt any of our Americans. We cannot hurt any of our seniors. Anyone who is living on a fixed income, we've got to make sure that everything is going to be okay for them. But at the same time, we've got to make those hard decisions, and we've got to lead, because that's what's going to save this country. So great question, and we are going to do everything we can to make sure that we can get these things through.
Very good. All right. Thank you very much. We're going to leave you there.